Now, Dr. Rollins joins us to give more health advice. There's a recent study about metabolic syndrome. I'm not really sure what that's about, so
Metabolic
please
syndrome.
give us a breakdown.
Right. I think in the news today there's some studies recently looking at metabolic syndrome, so that's a great one to talk about and right up our alley. So metabolic syndrome is probably one of the most common health conditions out there today. When you look at and it doesn't really get diagnosed as a category like it should. What you end up seeing is diagnoses of high blood sugar, diabetes, or overweight or high blood pressure. But metabolic syndrome is a syndrome or a collection of things that includes being a little fat around the middle. So if men have about more than 40 inches around their midline, women 36 inches, I think that's part of the definition. But you tend to run with a little high blood pressure. One of the blood fats called triglycerides is a little high. The good cholesterol is a little low. If you don't have high blood sugar yet, you're working on it, so you have insulin resistance. So it's this combination of things that starts happening, and it's really common. And long before people ever have a diagnosis of some of the diseases that come out of this, we can see metabolic syndrome plain as day. So we really need to be paying attention to it more and recognizing it. The good news is that even without doctors diagnosing it per se, people can recognize it themselves and do a lot about it. So essentially what you want to start thinking about is treating like you would a diabetic. You need to start thinking about low sugar type diets, weight loss, some of the basic stuff. But I thought I'd comment about a little pearl that we who practice functional medicine see helpful a lot for metabolic syndrome. And this goes back to some of the core principles of functional medicine. We look at these other things in the blood that I just told you about, but what I'm thinking about is this person may have some delayed food allergies, or they may have leaky gut, and some of these kind of things. And I've talked before about the importance of the gut and the immune system. So around 70 to 80% of your entire immune system surrounds your gut. And so there's this massive interface between your digestive tract and your immune system. So it's very common that people have delayed food allergies to things they would never think about. Now, not immediate allergies like a bee sting or hay fever.
Right.
That you would figure out.
Yeah, pretty quickly.
You'd eat something and within 30 minutes you feel bad, so you make the connection. But delayed allergies are sneaky. They take a day or two to get cooking, and what they do stimulate the immune system, and you don't know. It causes a lot of inflammation, which drives cortisol, your stress hormone, and guess what? That'll drive your blood pressure, that'll drive your blood sugar, that makes your cholesterol look bad. So I've been finding in recent years a lot of people with metabolic syndrome have a dynamite outcome looking at gut health and delayed food allergy testing, and that's kind of a little subtle pearl. We've helped a lot of folks turn it right around. So I'm thinking that there may be a lot more of this driving that than we can recognize. Another thing that probably drives metabolic syndrome that is kind of off the radar screen a little bit would be hormone disorders. So undiagnosed low thyroid, people that have undiagnosed low testosterone with aging, that has a lot to do with your metabolism and these kinds of things. So think about gut health and think about sneaky hormone disorders if you're someone that's dealing with metabolic syndrome.
Okay, so stuff you may not necessarily think about, but you got the body's all connected. So.
That's right, it is all connected. Thanks.
All right, thanks so much, Dr. Rollins. We'll be right back right after the break.